All right. Hello, welcome to YouTube channel Health Cube, the place where our mission is not only to motivate you but help you to move on to the brighter side of the health. Today we are here with a very important topic that most of us would love to know, and that is about back pain. How to take control of your back pain, or else how you can prevent your back pain. To your surprise, you would be glad to know this that back pain can be very easily prevented if you take certain guidelines into consideration. These guidelines are very simple, easy to follow, and effective. What are these guidelines? What are the do's and don'ts that help you to prevent your back pain? We are going to discuss all of them in today's live session. And to discuss that with me, I have Dr. Purnima, who is a musculoskeletal and sports physiotherapist with Health Q Rehab. She is doing a deep research and deep work on back pain management and chronic pain management. And based on her research and her understanding, she's going to talk about how to prevent back pain in today's session. So feel free to post your questions, any doubts that you have got, and meanwhile, enjoy this session. Over to you, Dr. Purnima.
Thank you, ma'am. Today I'm Dr. Purnima Bharat. I'm a musculoskeletal and sports physiotherapist. Today we are going to know more about lower back pain and how you can control your lower back pain with simple and easy steps. So we at HealthQ Rehab, we our vision and mission is to help 1 billion people to move better. So
So there is a bottom, there is a present button. You can just tap that so you will be able to share the screen.
yeah, sorry for the interruption. Yeah. Yeah. Our main vision is to help 1 billion people to move better. And we have a physio rehab programs which allow you to deal with your neuromuscular as well as musculoskeletal conditions and improve your quality of life. First of all, to know about the problem, you should completely know about the to solve your problem. You have to completely know about your problem. So learning about the problem is the key solution. So when you know completely, or if you completely understand your problem well, then you can solve it in a good way. So same with the lower back pain. See, so many people have so many things that the lower back pain, it is not going back to their normal state. uh, and but they never think that only simple things, if they learn about these things, they can prevent it and also they can manage it well. So first of all, you should be enthusiastic and you should be you should know completely about the problem. So learning about the problem is the key for your solution. So completely from this workshop, I hope you can learn everything about your lower back pain. And what is lower back pain? So the structures, first, to know about your lower back pain, you should know what are the structures surrounding and what are the bones, what are the ligaments, what are the what are the muscles. I'm not going to go more on anatomy or anything, just the basic, but this is really important for you to know, because you may not know that by learning these simple structures which are having the problem itself, can you can cure it well. So you can understand what the physiotherapist is telling you if you understand the structures which are present in the painful areas. So this is your spine. we have if you must have heard that from L4 to L5 is my, like I'm having a disc bulge, or I'm having an osteoarthritis at this area, or I'm having some strain in this area. So if we see these five are lower back spine, lower back vertebra, and in between you can see that there are blue color structures, which is a fluid structure, which is known as disc. This is where so many problem arises, because there will be compression of this disc, and there will be loss of this disc density. So because of this, the disc comes out of the vertebra, between the vertebra, and it can cause a small pinching of the nerve, which can cause neurological symptoms, which can cause your sciatica problems also. So these are the vertebrae. In between this, there will be a disc which causes more of the pathologies which nowadays we are seeing. But we can't confirmly say that these are completely because of your disc bulge, or your osteoarthritis, or herniated disc, or anything like that. But your low back pain may be because of a simple muscle strain. So the muscles which surround around this area are many muscles, there will be many muscles, and a simple provocation can cause so much of damage to that area, which can cause your lower back pains. So what causes your lower back pain are simple. One is muscle strain. Muscle strain is nothing but the muscles surrounding that area can a little bit of stretch happen in that area, and it is causing a discomfort in that area. These pains, muscle sprains, can go away in more less than 3 months. Not even 3 months, it can take around maybe around 1 month or 2 months, that's it. But the main problem which we are facing nowadays, because of the dietary changes we have, or because of the things which we do, like, without any postural advices, by lifting the weights or anything. So those are mainly because of our chronic pains. Those are our chronic pains. So we have two types of pains. One is acute pain, and the second one is chronic pain. So acute pains are, like we discussed, these are more like muscle strains. That is more of the changes which are happening in the muscle, and the pain will go in less than 3 months. But the other problem is chronic pains. Chronic pains are like they will stay with us completely with like more than 3 months. They can cause a lot of damage to our mental health, as well as to our there is a research saying that 25 to 30% of the people who are suffering from chronic pains have a lot of mental health damage. Like, they can't able to mingle with the society, they can't able to do their simple daily activities, which they do normal people can do regularly. So these chronic pains can be the reason. These chronic pains, how we can say that the difference between the acute and chronic is, if the pain stays more than 3 months, then it is a chronic pain for you. So for chronic pain, what are the causes of our chronic lower back pain? There are many categories, but these days most of the time what we hear is disc bulge. Disc bulge is, here you can see the image. Before we have discussed that between two vertebra there will be a disc, right? So what happens, because of the degenerative changes, or it may be because of the age, or it may be because of the food or dietary changes we take, the gap between the vertebra will be decreased, and the disc which is present in the middle will protrude out. So this is how it will come out from that area, or this image can show you clearly. So that disc can press, this is the spinal nerves, these can pinch your nerves, and this can cause your damage. And this is one of the lower back pain, chronic lower back pain issue, which we are facing nowadays. And there are so many, like, we can avoid complete, like, we can avoid surgeries, and we can delay the surgical process, because so many doctors will recommend surgeries for this kind of chronic pains. But we can give it time, and we can definitely avoid the surgery if we do simple steps with our physiotherapy treatment. There are many cases which we have cured with a disc bulge or herniated discs. There is no need to go to the surgery as of such. With the simple techniques, they can avoid these surgeries also. And the number one cause, like this is the number one cause. The second cause, which is recently we are seeing, is arthritis, where generally you must have heard about arthritis. It is more towards the knee, but this spine, even any bone in the body, can undergo arthritis. That is degenerative change. Arthritis is the space between the joint, the vertebra which we have. It is a bony structure, right? So there will be degeneration in that, and there will be formation of spurs, that is bone, extra bone growth in that area. And when there is no liquid in between, they both come close again, and they will be causing so much of pressure in that area and cause so much of damage to that. So there will be a lot of swelling, there will be so much of discomfort in that area. So this is one of the cause of your lower back pain. So any cause, any the herniated disc or any other things, you can prevent it and avoid the surgeries with a physiotherapy treatment and the preventive measures which we are going to discuss now. Why is it so common? Why is it happening these days so commonly? Is because of poor posture habits. So many people are not taking a good postural advices, or they are not at all concentrating on their posture. That is like they will okay, they think that posture awareness is just sitting straight, making the muscles curl. That is not the thing. That is, you have to adopt it in your lifestyle. So that is how we have to do. So the one of the main reason why it is why lower back pain has become so common is because of the postural changes or posture how we maintain. And also the second reason why lower back pains are more common is because of lack of exercise. So if we are doing the people who have chronic pains definitely avoid exercise. But the thing is, if you avoid the exercise, the pain will increase. You think that if you do the exercise, the pain is coming, like you are feeling hurt or like that. Maybe 2 days you will feel pain, but on the third day onwards the muscle will get strengthened and the pain will go back. The pain won't be there if you do the same exercise set. So no need to worry. You have to take an good advice of a physiotherapist with your chronic pain so that you can do better, even with your pain issues. And how back pain impacts your quality of life. How is it impacting? There will be, you can't be able to go out or sit for longer times, maybe because of your lower back pain, or it may impact your work related issues. And it can impact your health also, like because of the lower back pain you are not exercising and it can impact your health. So you have to improve your quality of life by preventing it and managing it well with an advice. So we can move on to our next thing, how we can prevent it and avoid these lower back pains. How do you prevent it? So, for to prevent it, the main important step is two things. One is what you should do with lower back pain, and what you shouldn't do with your lower back pain. If you're a person who have lower back pain with a chronic state, and if you are doing normal activities like bending, doing all the things, it won't work for you. At least not right now. But with correct guidance and with correct exercise set, maybe in the future you can do all the activities which we are like which are avoided for you right now. But what the things which you should avoid are, first one, you shouldn't lie on prone position. Like so many have the habit prone, in the sense you shouldn't lie on your stomach. Okay, so while you are lying on your stomach, so many have that habit. They can only sleep in lying on their stomach area. But the thing is, it is not at all good. And it will just cause the natural curvature of the spine to go away. So always it's better to lie on straight position or on the side with a good pillow support, so that all the muscles are rested well. Even in if you are lying on your stomach, there will be a lot of damage to your neck as well, neck muscles as well. Like you have to sleep either to the side or this side, so the neck muscles will get strained a lot. So please avoid this movement if you are having a lower back pain. And also you shouldn't lift weights. Okay, how can I, how, why shouldn't I lift? You may be like, should I completely stop lifting weight? No. We as a physiotherapist won't recommend you to rest completely. There is no need to rest completely with your lower back pain or anything, but you have to modify it. That is the main part. You shouldn't completely avoid anything, but by modifying the thing you can, you can do well. Okay, example, if you are lifting completely from the down using your back muscles, obviously the back muscles are not trained to that, so you have to use more of your leg muscles. Do a squat and then lift the weight up. Then it is going to affect, it is not going to affect your lower back muscles much. They are not designed that way, but your leg muscles are designed that way, so that it will be easy for you to lift it up without your lower back pain. So that is one of the modification you can do in your lifestyle while you are having a lower back pain. The third thing, bending. So so many people now are more interested, women or men are more interested in yoga, so you are more doing bending activities. But what why we are not recommending you to bend completely is because this is your spine and you're already having chronic pain. That is because, maybe because of your disc bulge, maybe because of arthritis. So what happening is you're completely pressing that more if you're bending forward. So you're pressing that bones completely and you're making the condition worse. So please avoid complete bending till you strengthen your muscles, or having that capacity without any symptoms. Till that time, please avoid bending. And fourth one is your posture, how you're sitting. So you may be sitting in a wrong way, like completely in front or in the back, but that is like, you, I'm not telling that you shouldn't work, but taking breaks in the middle can help you better. And the fourth one is like, you shouldn't completely twist to the sides, sudden movements. Okay, sudden twistings are avoided because it can cause a lot of damage to the structures around that area. And high impact exercises, you shouldn't do high impact exercises if you're having a lower back pain. I'm not telling complete exercises are wrong for you, but there is a difference between exercises, that there are three kinds of exercises: low impact, high impact, and medium. So in low impact exercises you can do well, because in the starting stage of your lower back pain, if you start with low, then medium, then high, it will work for you. But if you start with high exercises like running or complete toe touches, these are not good for you. So what is right for you, a physiotherapist can recommend you well better, or a doctor can prescribe you correct ways how you can do that. So those exercises, high impact or low impact, you should know about those exercises and do them. You shouldn't completely avoid the exercises even with your lower back pain. That is not recommended. And what you should do with back pain, now these are the don'ts. One is lying on your stomach is avoided. Lifting weights completely using your lower back muscles aren't avoid, you should avoid that. And bending, twisting movements, posture, you shouldn't be slouching movements or anything. And you shouldn't be doing high impact exercises. And what you should do with lower back pain, so, first one is, if you're working, you have to take at least 15 minutes break, at least 30 minutes, every 30 minutes in the middle, at least 10 minutes you go for a walk. You keep alarms, you keep yourself engaged, some recreational activity in the middle, like watching some, going out and watching, you play with your dog, maybe those kind of breaks, a simple 10-minute break in between your 1 hour of session, like that, it will help you much better. You should do that if you are having a lower back pain. Constant sitting in one place is completely avoided for you. The second thing are, there are many tools which can help you to maintain your posture as well as to relax your body. So first one, postural tools which can help you better are, one of the best thing is, like, we have everyone have ergonomic chairs, right? But ergonomic chairs, even if we have ergonomic chair, this is an ergonomic chair, but if you are sitting, even you buy it, what is the use of buying it? There is, if you buy it, it is not going to work. If even with your ergonomic chair you will be sitting like this completely, or moving front, then there won't be any use. So you should definitely take a backrest support. So we have a thing like this is one of the best product which we have, not a product kind, but it can help you rest better in the back, so that it give you complete relaxation in the back. So these kind of tools, there are many tools which can support you in a better way for your lower back pain. I'm not telling that you should readily buy it or anything, but you should know, at least aware of these products, so that you can see how these are changing you. So you have to at least practice them, not as early as possible, but at least you have to try them and see whether it's working for you or not. So there are these kind of tools you can see. And also, body relaxation is the main thing you have to do, that is relaxing all the muscles in and around your area. We physiotherapists have many techniques to do that. Like we have a progressive relaxation technique, where you will with our voiceover, you will be relaxing and holding your muscles and relaxing the body. So there are many techniques which we can help you with relaxing your body. Why body relaxation is important? If a muscle is completely strained, even if you are doing exercise, but the muscle is not relaxed, it is not going to help you, right? So first you should relax your body, you should relax your muscles first, then you have to do the exercise, then it is going to work well with you. Like many techniques can help you with that. You can reach out to us for that in the later, or you can comment below if you want any questions regarding that. And there are exercises, there are many exercises you should do for your lower back pain. It depends on your body. It doesn't work that you can do these exercises, you can do this exercise. Every body is different. So every body is different, every pain is different. So if you're having a disc bulge, there are specific kind of exercises which a physiotherapist can recommend you, which they can customize it for you, which we can do that. So you have to we have to take an assessment, complete assessment of yours, and we can give you the right kind of exercises, so that your condition is getting better. So the exercise, for your chronic pain, you shouldn't completely avoid the exercises, but a modified, customized exercises can help you much better to manage your chronic pain. So, and the most important thing what you should do with your lower back pain is meditation or mental health relaxation. See, with the chronic lower back pain, I'm not talking about acute pain which can come and go away like that, but chronic pain, I already told you that with research, 25 to 30% people are having mental health issues, like they can't do their normal activities freely, or for those people, definitely meditation, or there are many techniques, guided imagery is there are many techniques which can help you better to relax your body as well as your mind. So this you should do with your lower back pain. To prevent it also, it can help you much better. And how do you manage it? So we can manage, like for your chronic pain, first of all, we have to manage that, we have to assess you completely, where the assessment consists of many techniques which we will do, like what muscles are affected, what areas of ligaments are strained, or these all things we will take it into picture. Then only we will be able to give you a program or a customized exercises for you in a correct way, where you can do, and definitely there will be a decrease of your lower back pain. So this is a chronic pain management program which we have designed especially for the people who are having pain, chronic pain, lower back pain issues, and we focuses not only on one aspect. See, if we are doing only pain management, it is not going to work for people who are having chronic pain. Because if we the people, after the pain is gone, they will go back to home, and after few days the pain can come back, right? So how to deal with this kind of pains? It's coming, it's going, like that it will be staying with you for longer than 3 months and all. So what we can break the cycle only by complete holistic approach. So we should completely take care of your lower back pain by different, like holistic, all aspects. That is, first your body, second is your mental health, third is your lifestyle modifications, what you have to do, the fourth one is your exercise set, which you have to do it, like what exercises you are needed, and what are the things which will help you much better. So this is one of the and postural correction. This fifth one is postural correction. So body relaxation, mental relaxation. So this is an holistic approach. That is, in every way possible, we will be trying to decrease the chronic pain as much as possible. We are not leaving any aspect which can trigger the pain back. So these are all the triggers for the pain to come back again. Like if we are only treating body relaxation, that is like MFR techniques, that can be TENS, that can be ultrasound, and we are leaving your mental health and lifestyle modification, then what is the use? There won't be any, you will be returning back for this only. So what we in this program we are doing is, we are completely giving, like we will treat body relaxation, mental relaxation, lifestyle, what are the things which is affecting your lifestyle, why it is so recurrent, your lower back pain is, and posture, what postures you have to adopt, and exercises which is customized for you. So body relaxation, we will be doing it with ultrasound therapy. So many of you, like if you are having a chronic pain, you must definitely be recommended that you have to do ultrasound therapy. There will be like we need to. This helps really well with swelling, that acute kind stage. Like if you are having sudden pain, or even with chronic pains, it will work well. If with the swelling or the pain, accumulation of pain elements in that area, ultrasound will work really well, and it can decrease the pain level and also swelling. And TENS and IFT is really good for chronic pain patients, where we are giving them, and there are so much of results as of such. It can block but these are not permanent solutions. So for the permanent solution, we need to, if we need to achieve, it should be a holistic approach. You have to try it, as well as we as a physiotherapist, we should try it, and you as a patient also should focus on your well-being. So if you're not doing the exercise, even we are telling, it's not going to work in that way. It should be, you have to modify your lifestyle, you have to modify your posture according to the advices we give you. And there are MFR techniques. MFR techniques is more of the fascia which surrounding the muscle. There will be a thin layer which surrounds the muscle areas, which can become so tight. So we will be releasing that and give a relaxation in that area. And we have PNF techniques, that is proprioceptive neuromuscular facilitation, where you will be doing tasks, normal tasks, and we will be encouraging you to do the activities. And there is Jacobson's relaxation technique, that is lying down, and you have to contract your body and relax it, so that the body will be relaxed completely. And there is the after body relaxation, we have to do mental relaxation by breathing exercises, pranayamas, mindful meditation, guided imagery, and progressive relaxation techniques. There are many techniques for mental health. And people who are having chronic pains, not only chronic lower back pain, but any chronic pains, definitely have to take a mental relaxation therapy, from either from a physiotherapist, either from a yoga therapist. You can follow the best way you can, but it should be a holistic approach with body relaxation, mental relaxation, all the things. And the third important thing is lifestyle modifications. Lifestyle modification consists of three things. First one is your dietary changes. and your sleep quality and your physical activity. In dietary changes, so many people who are having chronic pains are it is advised for them not to eat like in a normal way. They are like it is a there is a thing like we shouldn't eat potatoes as it can increase more of your damage to the more damage to your bones. So these things according to their body type and according to their habits we have to recommend them. And the second thing is their sleep quality. So many people who have chronic pain have so much difficulty in sleeping. So what is causing that discomfort, what is causing their discomfort, we should find about that and completely cure that. That may be because of the snoring pattern they have. So there are many techniques we can avoid snoring, and those things we will be learning. And physical activity, there definitely should be a physical activity if the people having lower back pain, because the physical activity is not like high impacted ones. You shouldn't run or anything like that, but a modified exercise set for you, customized for you, will work well with you. So these lifestyle modifications you have to make. And postural corrections, we have work ergonomics. Work ergonomics is how to sit with your laptop or with your screen on your front. So it should be always to your eye level. The screen should be towards your eye level, and the legs should be straight. The hands should rest on the complete rest on your desk, and you have to work in this way and with the support of your complete support of your back. That's how we have to do the movements. And there is mirror therapy which you can do. Yeah. For postural corrections, we have to do a mirror therapy where you will be completely you have to stand beside behind your mirror, and you have to check yourself whether it is going to work for you or not. Like on the see, sometimes what happens, if you see in the mirror your neck must be, if right now if you go stand at the mirror and check yourself how, and draw a straight line on the mirror and stand uh, half it to your body and see how is your neck tilted. Is it neck tilted, or is it tilted towards your right, or is it tilted towards your left? Or and see whether your chest is correctly in the on the line, and see how your hip is it up, is it down, that way. So you will be checking each and uh, everything with mirror therapy well. This postural correction can help very well with mirror therapy. So you can do it at your home level. No need to like you can get you that awareness, body awareness, by looking into the mirror. And body awareness, how you can do is close your eyes and do all the movements which we are doing right now. First movement is side. Do it for 5 times. Three, 4, and 5. And come back and open your eyes. While you are doing this movement, you have to feel what are the muscles moving. Like is it painful on this side or this side? When if you feel painful on this side, you must have observed that this side is more tight for you, but you may not know that because you are not aware of your body. So when you are doing every movement with eyes closed and feeling the movement, you will, if you feel any pain in any area, you can see that area is tight or that area has the problem, and so that you can work on that. So these all things we will be doing as a physiotherapist, and we will be giving a holistic approach at our clinic. So, and there are many cases which we have successfully treated, and they have there is no pain for the people who have the pain cycle is decreased a lot compared to normal physiotherapy, that is basic one, that is ultrasound therapy or TENS therapy. These are the basic ones, but to achieve a chronic pain to decrease the chronic pain level, we need to do all these techniques to ensure that the person is having a better quality of life. And progressive exercise for chronic pain, this is where the exercise set we are going to tell is like, we have range of motion exercises, stretchings, strengthening exercises, whole body exercises along with relaxation, and somatic exercises to maintain body in correct alignment mentally and physically. So what is progressive exercises? If you go to a physiotherapist or any other person, if you are with a pain and we ask you to do the exercise, are you willing to do? So many people are doing exercise with pain. See, literally, if you're doing exercise with pain, it is never going to work for you. You have to, with pain you shouldn't do the exercise, the bigger ones I'm telling. But when at least the pain should come from pain rating scale. There is a pain rating scale like 1 to 10. Okay, we physiotherapists will ask the patient how much pain is they are feeling right now. So 1 is the least pain and 10 is the highest pain they are having. So if the patient told that 8 is my pain, we really don't recommend them to do the exercise. We will first give them body relaxation, mental relaxation, lifestyle modifications, and postural corrections, but not exercise set. But when the patient having 8 kind of pain, should really take other therapies compared to this therapy. And after this, we can go to like, if the patient is telling that he is having around 4 or 5 kind of pain, then we will start with the exercise set, where the exercises are customized for them, and the exercises which are correct for them. And that also will be taking in 5 steps. First, we will be giving range of motion, that is simple exercises like moving the leg up down, these simple kind of exercises. So these exercises we will give them at to home, at least for they have to do it for at least for 15 days or 20 days. Then we will ask them to come for their second set and see and assess them completely how they have done their first set. Is it perfect or not? We can guess that if the person have done the exercise, there will be so much of decreased spasticity in that area. They won't be tight, the muscles won't be tight. If the muscles is still tight, even if they are doing the exercise, it never happened till now. But so if they are doing the exercise, definitely the muscles will get relaxed, and there will be definitely decreased spasticity in that area, so that we can give more of stretching next. So the stretches should be done only after range of motion exercises, which we are going to do. Then the third set, then we will give stretching for at least for 1 month for them. Then we will ask them to come for their strengthening exercises, where their muscles should get strengthened. And to the main part in the strengthening is, we will give strengthening because the chronic pain, people who are having chronic pain, then their bones are already weak. So we should at least strengthen the muscle area so that they can compensate for the bone. And the whole body exercise along with relaxation will be given. And somatic exercises are like body awareness. Before we have spoke about body awareness, right? So complete body awareness along with the structural changes which happens in the body, we will be doing that as well. So these are the things which we will be doing in this complete program. So you can if you are having any doubts or anything regarding that, you can comment. You can just write it down in the box, so that we will answer your questions. We complete this program is completely holistic approach. We will be giving complete top to bottom things for the patient, so that the chronic pain is not recurrent, it is not coming recurrently, and it is decreasing their pain and also increasing their quality of life. That is our aim. So, yeah. So I hope everyone has understood what is how you can prevent it, and what are the things you can avoid, what are the things you should do with your lower back pain, and what are the things you should avoid with the lower back pain, and how you can prevent it, and how you can manage it well, with the chronic pain management programs which we as a physiotherapists are giving to you. Really, you can completely get away from your chronic pain only with this holistic approach. Don't go for a physiotherapy like normal basic one, ultrasound, tens. These are not going to work. Really complete holistic, even with you have to change yourself as well. You have to modify yourself. There are many techniques which you have to which we can teach you to modify yourself. So you from your end, you have to give that effort, so that there won't be any chronic pain issues for you in the future. And so if you're having any doubts or anything, please comment below. And also we you can reach out to us, and to know more about our program. There is a website link below, www.healthqrehab.com, where you can reach out to us and you can clear your personalized doubts with us. And we are really ready to answer your questions, and really ready to help you much better way in a single one-to-one session. Thank you so much.